here on the Zoom. I want to thank everyone who is joining us on Facebook Live on the stream and who couldn't be here today or couldn't be on the Zoom. I wish we were doing this rally here at the Capitol all in person, but for a variety of factors, not the least of which was the time to put this together, this seemed the best and most expedient option, and one that I have no doubt all of you have become all too familiar with over the past year. But we are here today on a very important issue, which is really a microcosm of what has been a larger issue, and that is the seemingly arbitrary or confusing edicts, mandates, directives that have come from the governor and from his executive agencies and New York State over the past year. And just as we thought we were sort of moving past that, and we were moving towards, loosening of restrictions, the reopening of New York, more and more people getting vaccine or having access to the vaccine. Now, all of a sudden, we have this, what I can term is, to me, a ridiculous mandate or guidance that daycares, including children as young as 2, have to wear masks. And I can tell you over the past week, and I speak for my colleagues, I'm sure, my office has been inundated with phone calls from parents, from phone calls from providers. The parents are angry. The parents are frustrated. The parents think this is ridiculous. The daycare providers, no doubt, probably feel the same, but they're also confused. What does this mean for me? How am I supposed to enforce this guidance? And I think that brings about a lot of questions regarding this. One, if this was the scientific smart thing, where was this guidance? How come it hasn't been in place for the better part of the last year? Were we less concerned about our children over the last year? Daycares have been open the entire time. Parents have decided a long time ago what they were comfortable with their daycare provider. And just this morning, I was talking to a few parents who said, I need my daycare to be open. I need to know what's going on. I don't want my child to have a mask on, but I need to drop them off at daycare because I have to get back to work. And so that brings up, the second issue, which is, this is just, to me, the most impractical, enforceable directive that we've yet had because of the population we're talking about. I know when my nieces and nephews were 2, you were lucky if they kept the rest of their clothes on at all times, including their socks and their shirt and everything else. And so if a Department of Health person walks into a daycare provider and there's a 2-year-old or a 3-year-old without their mask on, are they going to be fined? I mean, who is going to be held responsible for enforcing what can only be termed as a really, I think, a far stretch? When we talk about daycare providers, many of them have been vaccinated or certainly have access to the vaccine. Parents certainly have access to the vaccine. The reason we would require this population to be masked at all times seems like we've really jumped the shark in this COVID narrative that we've been living in for the past year. And again, for those that will say, well, the CDC guidance, well, this governor and the state of New York and his agencies have chosen very selectively over the better part of a year which CDC guidance they followed and which CDC guidance they have not. And why they've selected this is beyond me. I would even challenge the CDC to explain why this guidance makes sense. But again, none of this would be happening, and I think this is important, if the state legislature fully rescinded the governor's broad executive authority. We wouldn't have to depend solely on his whims and the whims of those who work directly for him to determine these kinds of guidelines for our children, for our providers, who, by the way, have done a fantastic job for this during this entire pandemic, taking care of children in a very difficult time so that moms and dads could go to work. You think about our nurses and our doctors and our frontline workers, our essential workers who didn't have the luxury of being remote. Their kids had to be in daycare if that was applicable. And our daycare providers were there to safely take care of our children. And all we're asking is that we use a little bit of common sense as we move forward here. So I want to thank all of you, the providers. I want to thank the parents. Um, the governor should rescind this directive immediately. And if he is unwilling to do so, the state legislature should act. There's no reason we can't act. We've been elected to be a full governing partner, and we should do so if the governor is not willing to listen to the parents, listen to the providers. Yes, we need to listen to our medical professionals, but we also need to take some common sense here and listen to the people that these kinds of directives impact. So I want to thank again everyone for being on. I want to thank my colleagues who are on. And at this time, I know we're going to have several of my colleagues who are going to be speaking, but I want to introduce a friend of mine, someone who is a neighbor of mine up in Western New York, and I know who has been very, very strong advocating against this ridiculous policy and directive, and that is Senator Ed Rath.
Thank you very much, Leader Ort. It is my pleasure to be here today. And I want to first of all thank all the daycare providers and parents who are on this call with us. And I share in your perspective and everyone's perspective on this new directive from Albany. It is absolutely out of touch and it is inexplicable. And I as well have received many, many calls within my district office, as well as my personal phone from friends, neighbors, even relatives that are impacted by this incredible new mandate. And it's almost impossible to explain to them what's happening out of Albany. And yet again, it is an example of how out of touch Albany has become to the challenges and the struggles that everyone has faced over the last 14 months. And I share with you the perspective that this directive needs to be immediately rescinded and repealed in New York, because it is not appropriate, it's not timely, and it's not doing, quite honestly, any good for the children or for the daycare providers who have struggled over this past year like no one else, frankly. And what we have is an opportunity for leadership. And this is an opportunity for us in the state legislature to offer the leadership that is necessary to immediately repeal this unbelievable directive, because it's not enforceable. It was never, ever reviewed with the service providers or the subject matter experts, which is our daycare facilities. So I will work with everyone to get this repealed as soon as possible. And I also want to introduce into the conversation today, who's going to be speaking, Liz Sircone from the UB Child Care Center, who is a fellow Western New Yorker and knows firsthand what these challenges are presenting. Thank you, Leader Art.
Thank you, Senator Ort, for the opportunity to join this rally today and have the opportunity to speak. As an early childhood educator, I question why this mandate is being put into place now and not when the pandemic was at its worst, as you had mentioned earlier. Children in our programs were not required to wear masks at a time when no center had vaccinated staff. But now, as things seem to be getting better across the state and the country, suddenly this mandate has been put into place. And our centers were given less than 24 hours notice to comply, as we were notified on Wednesday afternoon last week that it was taking effect the following day. I could understand if suddenly there was an increase in cases tied to centers, but there has been very little child-to-child spread in childcare centers. In fact, our 2 locations in Buffalo have had absolutely zero child-to-child spread. We have families that are considering removing their children from our centers because of this mandate. We have tried to have our centers be a place where children can have some normalcy and not have to think about the pandemic. We have children telling us that they can't wait to go home last week so that they don't have to wear their mask. In our field, we're not supposed to force children to do anything based on our regulations, but we are supposed to force them to wear a mask. This doesn't make sense to, I'm sure, all my colleagues across the state. On top of that, what are going to be the long-term ramifications of mask wearing of children at such a young age? We worry that we will start to see delays in speech and development. So much of what we do is based on close personal interactions with young children, and we are missing out on those personal interactions when we don't see our facial expressions. This mandate is stressing out an already stressed and highly essential system. I am not sure how much more it can withstand before we begin to see a major collapse. I again thank you for the opportunity to be a representative of the early childhood community and to have our voice heard. Thank you.
Thanks so much, Liz. So I'll start by introducing myself. Hello, everyone. My name is Senator Mike Martucci, and I represent the 42nd State Senate District, which is the Hudson Valley and Catskills region of New York. And it's so great to see so many folks on here. So look, a lot of this has already been said already, but the real reality is it's sad that we're here right now. It's sad that we're here continuing to deal with arbitrary orders from Governor Cuomo. And myself, I see on this Zoom, my colleague, Senator Dan Steck, who's the ranking member on the Children and Families Committee. I serve on that committee with Senator Steck. And he and I both know, although my kids are a little younger than his, that anyone who has a 2-year-old like I do or had a 2-year-old like Dan does knows how ridiculous it is to believe that this is something that students will do or children will do all day at daycare or at camp. It's utterly nonsensical. It's unreasonable. This is just something, again, that when you look at this guidance, it's clear that it was drafted by someone who has not spent any time around a 2-year-old. Worse, this policy, as Leader Ort said, is the absolute opposite of what was put forward by the Office of Children and Family Services last June 26th. That policy recommended but did not require mask use by children in daycare or in camp settings at that time. And today, all we have are higher vaccination rates and lower infection rates. So, what's happened since then? As I said, all we've had is increased vaccinations, lower infections, and the CDC has rescinded mask mandates for vaccinated adults. Cuomo, after some pressure from us and others, has finally adopted those standards. So in short, things are a lot better than they were last June 26th. And really all that it remains is, the only question that remains is, why would Governor Cuomo choose now to mandate these masks for our toddlers? It makes absolutely no sense. It's not about public health. The only thing that I can surmise is it's really about control. As Leader Ort said, the last piece that I would add is this is really about the legislature right now stepping up. My colleagues, present company excluded, have allowed this to happen. The Democrat majorities in the state Senate have allowed the governor's powers to continue. And even despite the fact that the governor is under investigation from every imaginable source, he's under investigation from corruption, from the feds, from the attorney general here in our state, and others. Last week, our governor was asked about the outrage that people feel when they hear that he wrote a book and made $5 million. And his answer to reporters was, "That's stupid, next question." And when I think about this mask mandate, that's all I feel like saying is, this is stupid, next question. Look, I'm proud to be here today with our childcare providers and others in the industry stand up against this outrageous policy. And it's our obligation right now to fully bring pressure on this governor and other leaders in our body, the state Senate and the state assembly, to get this policy reversed immediately. So I thank you all for being here, and I encourage you all to keep up the pressure. Now, it's my pleasure to introduce a constituent of mine, someone who, like me, significantly questions the need for this order. Peggy Fuentes joins us today. She owns On My Way Early Childcare Center, which is among the most innovative childcare early learning centers in the state, designed to support the needs of families, working families and working parents. This facility is a licensed facility that provides educational and developmentally appropriate services for children between the ages of 6 weeks up to 12 years of age. So Peggy, thank you for joining us, and I turn the floor over to you.
Thank you, Senator. I appreciate it. My name is Peggy Fuentes, and my husband, Eric Fuentes, and I are the proud owners of On My Way Childcare. I sit before you today representing 4 other centers in our county: Patty Cake Playhouse, Windsor Academy, Little Harvard, and English Rose. Collectively, we represent 10% of the licensed childcare centers in Orange County. We were incredibly disappointed and shocked when we got the guidelines last Wednesday that our children, after 14 months of being unmasked, are required now to be masked. Last April, when the governor put out the mandate for everyone to wear masks, we received a memo from Commissioner Poole's office from OCFS that gave us interim guidelines that specifically said, and I will quote, "Children do not need to wear face coverings when they're in childcare program. In addition, outdoor space that belongs exclusively to childcare programs is not considered a public space." Governor Cuomo has always said he will follow the science. We conducted our own science survey among the centers that I represent today. And collectively, we have a total of 823 children enrolled in our programs. And in the past 14 months, 2% of our children contracted the virus. That's 16 children, many of whom were siblings. That's 14 months in the height of this pandemic. No vaccinations when we were asked to remain open so that essential workers could get to work. Many of them were doctors and nurses. Their children were coming here. They didn't contract the virus when they were on the front lines. With the infection rates and the hospitalizations down and the vaccination rate up, it just seems so illogical to us that now you're going to put this undue burden on our children in care. It absolutely makes no sense. And in a recent article, the governor was quoted by saying, and I quote, "Can you imagine childcare providers trying to put masks on 3 and 4-year-olds and keep them on all day? So I get it." Well, on behalf of all the childcare centers that I represent on this call and throughout the state, Governor, my response to you is no. We can't imagine putting masks on 2-year-olds, 3-year-olds, and 4-year-olds and keeping them on all day. Well, sometimes we can barely keep their shoes on. So, Governor, our response collectively on all the dynamic women and programs that I represent today, our response to you is we can't imagine it. And it is your responsibility and your authority to get rid of this mask mandate. You have the responsibility to all New Yorkers, including our 2-year-olds, our 3-year-olds, and our 4-year-olds, to ensure that you rescind this mask mandate. It makes no sense. So please, in your quote, you said you get it. Rescind the mask mandate and show us, the parents, the providers, and everybody out throughout the New York State, including our 2 and 3 and 4-year-olds, that you truly do get it. Thank you, everybody, for your time.
Good morning. I'm Senator Daphne Jordan, serving and representing the 43rd Senate District. As a mom whose children went to daycare and a state senator, I'm honored to take part in today's virtual rally to make our voices heard regarding the governor's ridiculous new mask mandates aimed at children as young as 2 years old. Most of what I'm going to say has been said, but maybe if we just keep repeating it, this governor will hear us. Our message: Governor Cuomo, unmask our kids. The governor's latest foolish edict demonstrates the continued depth of disconnect between his administration and reality. We learned on Wednesday when the Cuomo administration finally released details about the resumption of overnight summer camps that the governor also included a new government mandate that children over the age of 2 now must wear masks while in daycare. I've received many emails and Facebook messages from concerned constituents. They've said exactly what I'm saying. Governor Cuomo's new mandate is patently absurd. We know from medical experts that children are among the least affected by COVID. Yet somehow, some way, Governor Cuomo apparently does not know this basic fact. Throughout the COVID-19 pandemic, children in daycare were not subject to such an onerous mandate. What's the reason? What's the rationale? What's the science behind this new mandate? This mandate imposes a big burden on parents and providers. It is also not realistic to expect that a 2, 3, or 4-year-old will keep a mask on for 7, 8, or 9 hours per day while in daycare. With no answers, no justification, just more mandates from this governor, there's no masking the fact that Cuomo's a colossal disaster. Right now, I'd like to introduce our next 2 speakers from right here in the Capital Region. First, from my 43rd Senate District, my very good friend, Connie Reynolds, who owns Little Lambs Daycare, And also after Connie, Kristen Blaze from Tiny Town Daycare in Colony, who will follow Connie. Connie, we're all looking forward to hearing your professional perspective on this important issue.
Thank you. Thank you all for inviting me today. I have to tell you, I not only hold a background in education, a degree in education, but a license in nursing. So I understand the science behind why you might want to mask, but it doesn't apply to our children. Because if you're following the science, there are some things that are missing, such as word development. 70 to 93% of all communication is nonverbal. So the children at the youngest age, in infancy and up, would actually mimic and follow the nonverbal communication that they get from their childcare providers. At 8 months, they begin to imitate expressions and sounds and the mouth movements that you make. So with all of our staff being masked, that's a stage of development that our children just are not getting. And then if we move up to our 2-year-olds in that toddler stage, they should have approximately 50 words, and they begin to repeat words that they overhear. But if you're masked the entire time, how are these children going to learn what the words should sound like? How will this affect their speech going forward? Let's go on to our 3-year-olds. They have approximately 200 plus words, and they start to string them together in 3- and 4-word sentences. They begin to imitate intonation and tone. All of that is missing because not only do you have some of our children masked, but you have our staff that are masked as well. We have a large percentage of our staff who are vaccinated, and we would like to be unmasked so that we can start to make those connections with our children so that they will be bonded with us. We spend 50 plus hours a week with these children. It is the majority of their waking hours. And that's not to discredit the time that the parents have them on the weekend, but that's packed full of visits and everything else. We have some crucial learning time, and our children are missing out on that because not only are staff masked, but the children are masked. So the science says if we're vaccinated, we're very unlikely to transmit it. Our children have been masked for the 3-year-olds, but I will tell you that we have had 0 occurrence of children becoming infected in our program. None of our children have been infected. And even when there have been parents who were infected, the students never were infected. So I would just ask that we get back to doing our business and educating and nurturing children. Let us be unmasked. Thank you.
Hi, my name is Kristen Blaze. I'm the owner of Tiny Town of Colony, and I'd like to start by also saying that prior to doing daycare, I was in the medical field with the military for 10 years. So I also have that medical background and the education piece. So I actually opened my daycare center mid-pandemic. August 10th of last year, I transitioned from an in-home program to a center. And there was guidance that came out in 26 that said children didn't have to be masked if they were in daycare. So I was fortunate enough to leave it up to the parents on whether or not they thought that that would be beneficial for their children. And that was honestly what I believed. I thought that children losing the amount of time that they have socially and developmentally was a major impact on them long term. So having to wear a mask and not being able to see their friends and to interact with them by watching mouth cues and that crucial speech development that these children are going through at that time would be beneficial for them. So my staff, again, have majority been vaccinated. We've had 1 positive case throughout the entire pandemic in the last 14 months. And it's because of the hygiene that we're taking. We're ensuring that we're disinfecting and we're encouraging children not to touch their face. And we're doing the complete opposite now that they're being required to wear masks. Children and staff are constantly chasing the children around, encouraging to put the mask back on their face. They're touching their face. They don't always have time to wash their hands in between each child. So we're actually increasing the possibility of infection by getting rid of the disinfection piece, which is going to increase our numbers over time. So my question is, where does the science say that the children are potential carriers for the illness, or by putting a mask on them, it's going to prevent them from transmitting the disease to one another, because we haven't seen that at all. It hasn't been shown scientifically. We need to unmask the kids. They need to be kids. We need to stop taking away their time as children, and we need to allow them to develop socially, emotionally. And the other issue that we're running into now is speech therapists. I have multiple children in my program that receive services, and previously, at least the children were able to unmask so that the provider could help show them proper mouth formation. Now, with both providers and the child being masked, we have students that they're concerned about developing stutters or other concerns that would potentially have longer term effects on them. So my other question to Governor Cuomo is, why are you going to mask our children but increase our classroom capacities? It kind of goes against everything. Putting more children in a room together but requiring them to mask just scientifically doesn't make that much sense. So I stand with everybody that says we need to unmask our children, and we need to rescind everything that's been put out, and we need to let kids be kids again and stop taking away everything that we've taken away from them so far. Thank you for giving us the opportunity to speak, and I really look forward to hoping we make a difference.
Our next speaker is going to be Senator Palumbo.
Very good. Thank you. Can you hear me okay?
Yes, we can.
Oh, very good. Well, I'm honored to be here, and of course this testimony is it just further strengthens the position that we all agree on, that you know, the governor's got mandates and ideas regarding, you know, generally masking, but specifically this issue. It's just so arbitrary that it doesn't make sense. And I do have some concerned individuals from my district who would like to say a few words. So I do have Tara Broderick, who's a Long Island parent, who is next up to give some testimony. So Tara, if you'd like to take the floor, please feel free, and you're on. Thank you.
Hi, everyone, and thank you, Senator. My name is Tara Broderick, and I am the mother of a 3-year-old child who, as of last week, and for the first time since the pandemic started, is now being forced to wear a mask at daycare. The governor's newest mandate, a 23-page rule book forcing children 2 and up to wear masks at daycare and camps, imposes impractical, illogical, and frankly, impossible requirements. As a working class family, my husband and I rely on daycare in order to go to work. And what if my child refuses to wear the mask? Can he not go? You don't have to be a parent to understand the practical difficulties involved with getting toddlers to wear masks. If you can even get one on their face, they hang off their nose, they fall off their ears, they rip them off, and more often than not, they just refuse to wear it. 2- and 3-year-olds are still wearing diapers. How are they expected to keep a mask on? Even in the height of the pandemic, adults had difficulty wearing masks properly, and that was when it was for their own benefit. And now here we are trying to force toddlers to wear them for whose benefit? I think the most important point is to think it doesn't matter whether the science supports that a properly worn mask helps to prevent the spread of COVID or not. We don't have to have that conversation because it's irrelevant. Children, my son, toddlers, will never wear the mask properly, and therefore any desired result of the mask mandate will never be achieved. Instead, all we're doing is confusing, scaring, and upsetting our children. Also, in order to keep the mask with the child, most places ask that they have a lanyard so that they keep the mask with each respective child. Under no circumstances whatsoever is it acceptable to have a toddler going around his or her day with a string around their neck. This morning, when I dropped my son off, he had such a hard time with the mask and it broke my heart. And as a parent, I would give anything if it meant that my child and my children could live better. So I say, let them live, let them be little, let them smile at each other. And we as a society need to stand for one thing, and that's to act in the best interest of our children. So I say we unmask the kids. Thank you.
Hello, and first of all, Tara, thank you very much. This is, you see, can you all hear me? Okay. This is Senator George Borrello from the 57th Senate District. Thank you very much. Everyone's speaking today on this critically important issue. You know, today is May 24th. And why is that significant? Because had the Democratic leadership of both the Senate and the Assembly done nothing, we would be 24 days away from the April 30th deadline, the original deadline, that would have canceled the governor's unconstitutional executive authority, which is why we are where we are today. It's the reason why we are not able to actually have these children go to daycare and experience all of the education and help that they should be getting, as was spoken about earlier, about the fact that they need to see each other, see their faces, learn from that. And this is ridiculous that we have a governor that is no longer concerned with public safety. That's gone out the window a long time ago. This is now about this is no longer about public safety. It's about power and manipulation. It's about control. And quite frankly, I saw this coming, as we all did, which is why I introduced a concurrent resolution to repeal the governor's mask mandate before this most recent and most ridiculous mask mandate for 2-year-olds. This has to happen. We have to pass this. Whether you're a Democrat or Republican, the state legislature needs to step up and demand that this go away. And we need to pass this resolution so we can free up our children and our families. And now with that, I'd like to introduce someone who is also a frontline worker in my district, someone who has been there throughout this pandemic, providing that critical daycare. And that is Patrice Haskell, the owner of Kids Should Be Kids Daycare in Belmont, New York.
Hi, this is going to be repetitive. Thank you for letting me speak, but I wrote this weekend because I didn't want to forget anything. But we've already spoke about it all. I am a group family daycare in my home going on 9 years. People like this option for their children as they want it to feel like home when they're away from home. They can learn, they can play in a home setting. At the beginning of this pandemic, the governor was asking, encouraging, begging daycares to stay open and to help the essential workers. Some of us were able to stay open. Unfortunately, a lot of daycares closed because they couldn't survive without an income. Daycares have had no new guidelines since July 2020. On May 19th, 2021, the day the mask mandates were lifted for most people, we were hit with new guidelines, 23 pages mandating children 2 and up to wear masks. Why now, 14 months after the pandemic? Children cannot advocate for themselves, and it should be a parent's choice on their child's best interest. Children don't keep their socks on. How do you expect them to keep a mask on for 9 to 10 hours? Some parents have chose to send their children to daycare instead of school so that their children are not in masks all day. If we start making these children wear masks, people are going to pull their kids from daycare and they're going to find an unlicensed person, unregulated childcare to watch them. This will hurt the already struggling daycare industry, and who knows what kind of care these kids will actually get in an unlicensed setting. We already struggle with people running illegal daycares. This is going to make it worse. When kids get off the bus after school, the first thing they do is they pull their mask off and say, "It's nice to breathe and smell again." They complain about having to wear them as it's not fun playing with a friend with a mask on, and it makes it hard to breathe and talk to their friends. Masks on children can delay their social and their speech development. It is important that children are able to see full facial expressions and mouth movement during speaking so that they can learn mouth formation to learn to speak properly. This also makes it hard for anyone that's hearing impaired trying to understand what a young child is trying to say by reading their lips. We do health screenings when a child arrives throughout the day by taking temperatures and observing the child. We've done this before the pandemic. We have always encouraged proper hygiene and hand washing, yes, before the pandemic even hit. The same with the cleaning logs. We are now required to do extra paperwork that is really not needed. We have learned in our health and safety training, which all daycare centers have to take, how to clean and disinfect our toys properly. Any child care provider that is following the regulations was doing this way before the pandemic. So this is not new to us. We are strongly urging that New York State to reevaluate these mask guidelines and letting kids be kids and letting the parents make their choices for their children. Please remove the mask mandate. Thank you for listening and giving me the opportunity in this rally.
I think it's my turn to go now. I am State Senator Tom O'Mara, representing the South Lakes region of New York State. I want to thank all of our special guests for participating with us today in this extremely important topic, and Senate Republican leader Rob Ortt for hosting this for us today. This is an absurd order coming out of the governor's office once again. You know, in follow up to some of Senator Borrello's comments on the fact that the governor's emergency powers would have expired at the end of April had the Democrat majorities not extended that indefinitely. About 2 months ago, the Democrat majorities of the state legislature led us and led the people of the state of New York to believe that they had taken action to terminate the governor's emergency pandemic powers that had been granted in March of 2020. This Republican conference of the state Senate has moved on the floor of the Senate approximately 50 times since last June to terminate those powers. Just want to point out that on every one of those motions on the floor, every Republican voted to end the governor's emergency powers that he had been arbitrarily abusing for 14 months now. Each one of those 50 times we brought that motion to the floor, every Democrat legislator in the New York State Senate voted to not terminate those powers. And then about 2 months ago, they misled the people of the state of New York into believing that they were taking action to end the governor's emergency powers at that point. Well, this edict and directive that came out last week clearly proves that they were wrong, that they were misrepresenting, and that they lied to the people of the state of New York on what the powers of the governor continue to be. It's time that those powers end. This is just one more extreme example of the governor's abuse of that authority that was given to him. So again, I want to thank everybody for participating. I have a couple of special guests that I'd like to introduce now. The first will be Adam Donegan from Corning, New York, who has a parent of a child in the Corning Children's Center. And then we'll hear from Amber Thompson, who is the owner of Country Kids Childcare Center in Big Flats, New York. I want to thank Amber and Adam both for participating, as well as everybody else today. Thank you very much.
Thank you, Senator O'Mara, and I'm glad to be invited on this call. My name is Adam Donegan. I'm from Corning, New York, and like the Senator mentioned, my wife and I have a 3-year-old daughter at the Corning Children's Center. And throughout this entire pandemic, we have been essential workers and felt very safe in our child going there and all the precautions they have taken. They built a bubble around these kids, and it's just been wonderful to have 2, 3, and 4-year-olds not have to be a part of this pandemic, to be insulated from it. And now, when my daughter has to go to school to wear a mask, she is no longer insulated from this pandemic. She will always remember the days that she had to wear a mask when she was at daycare. And I don't feel safe with her there anymore because of this mask. And I think you can tell by my face that I'm very angry about this as a parent. This is ridiculous. It makes no sense that our kids can go to these daycares unmasked for the majority and through the hardest parts of this pandemic. And now all of a sudden, just as summer is beginning, let's put masks on these little kids. It's uncalled for. It's ridiculous. And so I have a couple asks that I've been thinking about while I was preparing for this call. Obviously, I can tell the New York State Senate Republicans and the New York State Assembly is doing all they can. And I appreciate that. And all us parents and caregivers appreciate that. But the second ask is I ask the media that's on this call, we need your help. We need you to report this more, make a bigger story about this, because this is a big story. We have over 50,000 people who have signed an online petition. There are people angry across this state, and I'm one of them, and my wife is one of them. And this is not right. This is not right. This is downright child abuse put on by our governor. So he needs to rescind this order. And the other ask, and the last ask I ask is for parents and caregivers. If you can, do not comply with this. This is ridiculous. This is overstepping. We are parents. We take care of our children. We make those decisions, not Governor Cuomo. He does not make the decisions about our kids like this. This is not protecting them. This is unnecessary. And it is downright child abuse. And that's all I have to say. Thank you.
Thank you, Senator O'Mara, and all of you for the opportunity to speak against these absurd mandates. For the past 14 months, childcare centers have continued to provide an essential ground level service for all other businesses to operate. We followed every mandate to a T, and we were never asked to mask these children, even when infection rates were at the highest. Why would a mandate come down now that we are at a 0.85% positivity rate across the state, as Governor Cuomo announced last Thursday, the lowest since November, when mask mandates in the community are being lifted and vaccines are readily available? When I called my local Office of Children and Family Services and asked them about this, I was told that the vaccine, so we must protect them. Would they be willing to admit that the governor was willingly putting these children in harm's way for the last 14 months then? We know that these children are at a very, very low infection rate. And as proof of that, I've had no infections in children at my center this entire time. Our job in childcare is to keep children safe, to help them develop. We have seen a drastic spike in speech delays that can be attributed to adult mask wearing. These children spend 9 to 10 hours a day, 5 days a week with us, without being able to see how our mouths move to form words themselves. Adding a mask to the children would only delay speech further and inhibit their cognitive, social, and emotional development. Our children deserve better. We must stand up against this. We must continue to do what's best for children in daycare and children all across from daycares.
Hello? I just pressed that. So
You're good to go, Senator Matera.
ready to go?
Yep.
Hi, everybody. And, my name is Senator Mario Matera. I represent the Senate District Number 2, which is Huntington, Smithtown, Brookhaven, Long Island. I just want to thank everybody that's been on this rally this morning, and heartfelt from everybody's heart. And it's so important because without family and our children, we don't have anything. But I want to thank our leader, Ort, for continuing to fight to make sure the voices of our residents are heard. Throughout this crisis, the input of those mostly impacted by COVID-19 decisions have been missing. And that unfortunately continues as we open up our state. Our businessmen, our women, our parents, and our children have suffered throughout this past year. As our state reopens, these voices must be part of the decision-making so that everyone is able to restart their lives, hopefully better and stronger than before. One of the most difficult things to watch throughout the pandemic has been the impact that it's had on our children. They have been isolated from their friends and from their family. They have been held back and have been had restrictions put on them when participating in youth sports, summer camps, day camps, and all other programs that kids find joy in, just like all of us when we were growing up. We must listen to the work that those closest to our children, their parents, their teachers, coaches, camp coordinators, and those who interact with them, and make sure they are all involved in any decision. Our children have gone through a full year of rules and restrictions, of isolation and fear. It is time to take back the rules and restrictions and unmask our kids. Governor Cuomo, please rescind this mandate today. Unmask our kids. That is why I want to thank Michael Singer of Innovative Martial Arts for joining us today to let us know the impact the new rules we have on our children of our community. Michael, I want to thank you very much for taking your time today from your very busy schedule. Are you on, Michael?
Thank you so much. And there are very great speakers today, and everybody should be very proud because the way that everyone is feeling needs to be heard. And it's a very big mistake for our government not to hear how we're feeling, our thoughts, the science, and there's a lot of information to understand about it. Thank you for letting me speak today, Senator Mario Matera. I appreciate the time. My name is Michael Singer. I own a few martial arts schools here on Long Island. I'm a husband, I'm a father. And right now, my biggest concern is, like any family man, is my daughter. You know, she's turning 2 very soon. And to think that she's not out of diapers yet, and we're gonna try to put a diaper on her face is very scary. She has trouble not putting things in her mouth. You know, Legos come with a warning for a reason. And now there's a concern that she's going to choke on this thing at school when she's in daycare. And that's a very real thing. Kids are shoving things in their mouth all the time. And obviously this isn't just affecting 2- and 3-year-olds. This goes all the way up to 12 years old at the moment. We have a governor right now who is taking a very monolithic approach to a complex situation with a lot of different factors and ignoring all of the other repercussions that kids are going through at the time. The biggest thing right now stopping us from getting back to normal is perception. People see the masks, they see fear. They're going to see us going backwards as if things are getting worse when it's the exact opposite. Things are getting better and we need to move forward as things get better. Businesses are going to do better when customers realize it's a safer place to be. I'm still having customers call us up asking if we're reopening. And we've been open for a long time now. You know, how are the kids doing? What are our rates? What are these things? We've been keeping track of all of these things. And for a business owner, it's more undue pressure. It's more stress. It's more red tape, protocols, procedures that we have to add into that, yes, costs us money, but it's costing us time and it's costing us headaches and training our employees on these new systems. It's a lot of different things that stop us from doing the things that we need to do. In my business in particular, I have kids exercising, running, jumping, doing all sorts of things that when we can, we keep at least 6 foot distance, unless obviously required by the activity, which is allowed under the current laws. But the biggest thing stopping us right now is the mask mandate. If we could get rid of that, we will take 30 steps forward in perception, in science, and everything. So thank you so much for having me. I appreciate the time. Please, let's get rid of these masks.
Thank you, everyone. I'm Senator Pete Oberacker, representing the 51st Senate District, second largest Senate district in New York, very rural in the counties that I represent. You know, one of the things, real quick, and then I'm going to turn this over to Bethany Tice, who is a very articulate and well-informed constituent in the 51st. But 2 things I'll leave you with. You know, number one, there's a common thread that runs through this rural district, which is they say common sense. And I had a gentleman come up to me the other day and he said, you know, common sense is a flower that does not grow in the garden in Albany. And I thought that was such an appropriate term that it made me smile. And then this other visual I'll leave you with before, again, I introduce Bethany Tice, is I would much rather try to herd 2-year-old steers that I have into a new pasture than I would ever try to wrangle a 2-year-old with a mask. And I just want to leave you with that visual. I think that basically says it all. Again, Beth is a mother. She comes from Cobleskill, of course, New York in the 51st. And I am going to turn it over to Beth and have her not only educate you, but educate me. Thanks, Beth.
Good morning. My name is Bethany Tice. I'm here representing the children that are in schools, not just in the daycares. I have a 5, a 7, and a 14-year-old. So this is a little bit longer than it's supposed to be, but I cannot shoot from the hip. So I come here today with concerns for our children. It started with 2 weeks to flatten the curve, and here we are, over a year later, and still unwilling to unmask our children. Why are we not following the science? Our state, as of the most recent update on 5/22, had a 0.77% positive test rate. The United States Census Bureau reported 19.45 million people lived in New York in 2019. 1,073 positive tests on 5/22. 19.45 million people. As of the state's last update on 5/22/21, Schoharie County, which is home to our CRCS district, had 0 positive cases out of 64 tests in a county that is home to more than 31,000 people. Let that sink in. 31,000 people, 0 positive test results. Please do the math. The fear mongering is unrealistic and deceptive. We are forcing our children to wear masks all day long, both inside and out. 5, 6, 7 hours a day, our children are wearing masks in temperatures that often reach 80 degrees or higher this time of year in upstate New York. Many in schools that do not have adequate cooling system. Has the governor ever sat in a 3rd floor room when it is 85 degrees out, or ran around on a playground for 30 minutes with a mask on his face and his mouth and nose? Likely not. Those who write and enforce these unrealistic mandates tend to do so from their air-conditioned office, and I'm willing to bet without a mask on. We as a community are failing. We are failing our children every day we send them to school with a mask on. They cannot openly talk to their friends. They cannot see expressions and emotion. They cannot see their teachers' smiles or their friends' smiles. And this is a subject that is near to my heart, as my 2 youngest children are profoundly deaf and rely on lip reading and facial expressions to communicate. Most importantly, they're not able to breathe the fresh air, a God-given right they have. We know from years of research the physiological and psychological burdens mask wearing can cause in children. During April to October 2020 in the US, emergency room visits linked to mental health problems such as anxiety for children aged 5 to 11 increased by nearly 25% and increased by 31% for those aged 12 to 17 years old as compared to the same period in 2019. Every day in our school, children are being scolded for not following the protocols, the COVID rules. Their masks are below their nose. Their drink is taking them too long. It is not time for a mask break. You are walking the wrong way in the hallway. You're too close to each other. The list of failures to our children grows longer and longer every day. These masks have become so politicized that it is preventing rational consideration of the evidence. The science is there. There have been hundreds of mask studies related to influenza transmission over several decades. It is a well-established fact that masks do not stop viruses. The wording on the box of masks that my children frequently wear to school states masks can filter certain contaminants, but they do not eliminate the risk of illness or infection. It also states a recommended use time for 4 hours or less. We know that in most cases, children are wearing their masks multiple times, touching them, dropping them on the floor, sharing them, etc. Surgical masks are for use in a controlled setting, like doctor's offices, surgical rooms, etc., where the user is specifically trained on the correct use and handling of a mask. Having trained as an LPN, I know firsthand the proper use and handling of these masks. And we all know our children are more concerned with being a kid than if they are properly taking off a contaminated mask. Right on the CDC website, they proclaim surgical masks do not catch all harmful particles and smoke, yet we make our children wear masks all day long. The size of a smoke particle is approximately 0.5 microns, which is 5 times the size of the SARS-CoV-2 virus. New York State and the schools mandating the use of face masks on children 2 and above are willfully ignoring established science and willingly entering every school district, daycare facility, and day camps into a clinical trial. The state mandate to wear a mask for viral transmission prevention is for emergency use only. Emergency use authorization by the FDA means the products are investigation and experimental only. Children have repeatedly been shown to not be drivers of this contagion. Children have a statistically 0% chance of dying from COVID. The CDC site states the K through 12 mortality rate with or with COVID is 0.00003. In the 2017-2018 flu season, the CDC estimates the actual number of childhood deaths to be close to 600 children. A far more communicable and deadly virus in this age group, yet we did not mandate masks. I cannot understand the mandates when the people most at risk have now had the opportunity to be vaccinated. I do not understand the positive outcome of masking our children when those at greatest risk are now protected. When will we follow the lead of the other states such as Florida, Texas, and Iowa? These states have lifted their face masks with no consequence to infection rates. We as parents have a right to refuse the use of masks on our children, especially in the case of something that is even fully FDA approved. The governor has abused his emergency powers for far too long. His mandates are a gross overreach of power. We ask that our elected officials fulfill the oath they took to defend the Constitution of the United States of America. Parents' rights to refuse an experimental practice are being hindered by unethical mandates. We are asking that our voices be heard, that our children's voices be heard. Let this decision to wear a mask be made within each family. Thank you for the opportunity to speak today.
Hi, everyone. This is Eileen Miller from Leader Ort's communications office. Unfortunately, the leader did have another obligation, so he did have to hop off, but we are going to do some media Q&A. If there is any media that does want to talk something from Senator Ort specifically, you can reach out to myself or Connor Murphy in the press office, and we will make sure to get that for you. But if you would like to ask a question, you can use the raise hand function or the chat feature. And we do have Senator Mike Martucci, who is going to pinch hit for Senator Ort. And if you have if you have a specific person you want to direct a question to, if you could, use the chat feature to let us know that ahead of time, that would be helpful. All right, and I'm going to turn it over to Senator Martucci for a very brief close.
Excellent, thank you. Well, look, first, I'm always glad to pinch hit for Senator Ort, especially when we have no questions from the media. But look, I think today the reason we have no questions is because our argument is very simple, and the folks that are here have clearly laid out the case. I think what I would certainly close with by saying, first of all, to all of the folks who joined, not only my colleagues, but in particular our constituents, thank you for coming here today. Thank you for speaking up. Thank you for being loud on this issue. What I want you to know is that this conference stands with you. Leader Ort and I had an opportunity to spend time this weekend together, and we spoke about this issue. It is dead in the front of our sights in terms of things that are affecting our families here in New York, and in particular, making it more difficult for our children. With so many of what was said today bears repeating, and I certainly don't want to be repetitive. But again, what I want to say is thank you all for speaking up and let you know you have a conference here that is going to be working hard to make sure that your voice is heard, because right now in the halls of Albany, it is not. This afternoon, I look forward to being out on the floor of the Senate, bringing this very issue up in the form of a hostile amendment to repeal our governor's powers. So I want you to know that our fight has already begun, and with your help continues right into this afternoon. So, again, without repeating all that has been said today, I want to thank you for being here. I want to let you know that we will continue to be a resource for you, and we will continue to fight to repeal this absolutely arbitrary, capricious, and unreasonable requirement that's making your life so difficult, that's making the lives of so many New York families difficult, and most importantly, is unnecessarily making the lives of our youngest New Yorkers, our small children, very, very difficult. So if there aren't any other questions, I thank you all for being here, and I hopefully look forward to seeing you all again very soon.